And let's now talk to OCTA Research. Joining us via Zoom is research fellow Dr. Guido. As always, Professor, thank you for joining us. Do tell us, what are your projections this week for the whole country and for NCR alone?
Ria, there's still no sign of slowing down. It may have slowed down just a little bit, but in the NCR, the positivity rate increased from 15.5% last week to 17.5% this week. And, it's a slight concern that we're not seeing a slowdown yet. We're probably going to be seeing more than 5,000 cases sometime this week or early next week, because we're not seeing the slowdown yet. We have detected some possible slowing down in some provinces like Rizal and Cavite. But overall, the positivity rates are now very high in many regions in Luzon Island, and in some provinces in Visayas and Mindanao. So specifically in Albay, in Benguet, in Cagayan, Camarines Sur, Cavite, Isabela, La Union, Laguna, Nueva Ecija, Pampanga, Pangasinan, Quezon, Rizal, Tarlac, Zambales, the positivity rates are all about 20%. In fact, in some provinces, they're reaching levels similar to what we saw last year in terms of positivity rate. So, the wave is not over. So we again advise our kababayans to, adhere to minimum public health standards and protect themselves.
Right, let's talk about the situation outside Metro Manila. You mentioned some provinces there. What are the provinces registering the highest number of new cases, and what could be causing this movement?
Well, as of yesterday, if we're looking at the count for the DOH report for yesterday, Cavite, Laguna, Rizal, Iloilo Province, Cebu, Pampanga, Bulacan, Davao del Sur, Benguet, and Batangas all had more than 100 cases yesterday. But again, we're not seeing the complete picture because testing is not quite up to the same levels as what we had last year or even earlier this year. So it's definitely spreading out in many parts of the country, not just in NCR, Calabarzon. So we're now seeing it also in parts of Visayas and Mindanao, and especially the northern provinces of Luzon, in Bicol region. We're definitely seeing upticks in cases.
Right, we're seeing these positivity rates going up. Does that mean we need to carry out more testing or more extensive testing?
Well, I think there's some testing being done, Ria, but a lot of testing has now switched to the antigen testing, and antigen testing is cheaper and it's portable. It's quicker. You can get the results within 15 minutes. So I hope there's some way that we can include the antigen test results in our accounts. Of course, the DOH does not consider it official, but at the same time, it is the reality that more people are getting antigen testing. A lot of people are not, going back to RT-PCR testing because it's more expensive and it takes more time to process.
Right, so we can safely assume this number of about 37,000 Filipinos or people in the Philippines who are currently ill, the real number must be much higher.
Definitely, Ria. It could be, it could be 10 times higher than that, or even more, based on our estimates of the numbers. So, of course, most of these people are asymptomatic or mild because we're not seeing an upsurge in hospital utilization. It is ticking up slightly, but hospital utilization is increasing in some places.
All right, I ask you this every week and every time we speak, Professor. Do we know when we will start seeing a decrease in the number of cases?
Right now, it's still a toss-up, Ria, and it's unfortunate. We're hoping that it could happen mid-August. The wave is already prolonged as it is. We were expecting a 2-month wave, just like in South Africa, and we're already past 2 months, and we even have not reached the peak. This will definitely last into the Burr months as it is right now. We repeat the call of the president, PBBM, for people to get their booster shots because the wave may be prolonged in part because of waning immunity. A lot of people got their vaccines last year, and by this time, a lot of people will have their immunity waning. So that may be causing the prolonged wave.
All right, Professor, thank you so much. That was OCTA Research Fellow Dr. Guido David.